lap sponges and so this isn't a rippy kind of thing, this is a splitty kind of thing. So when you split things, the inside is sterile because it's not going to touch anything unsterile. If you ripped it, it would touch the unsterile edge. Same deal here. Three cc's. If we did a little area, it would be a 1 cc syringe.
Like what would count
Always
as a
think
little
ahead
area?
what we're doing. A neck.
Okay.
Just an abdomen. 1 cc is enough if I'm only making 2 incisions.
Got it.
4-0 plain gut, which we use for most people, except for now that this we erased yesterday. We don't need, no, that's wrong, I'm sorry. You don't bring me a 30 gauge, we use a 30 gauge here.
Right.
So this is boring, we're just opening all this stuff.
Yeah.
This we're saving for that, this, I don't know why these are here. These we're not going to open now. Once I have gloves on, we'll open them. This has a corner here. Again, you're worried about things bouncing back, so you grab it and you hold it. So I've touched all this.
Right.
If the tubing touches it, I'm screwed. So I grab it here, and I go like that. It's all sterile and good. So now I put on my gloves. Down, I don't know why it's here. So again, the rippy opening means when this comes out, it's not sterile because it's passing through an unsterile edge. One knows it automatically. One has to internalize that forevermore. Putting on gloves. Now you saw how this rolled, so
Yeah.
obviously this looks sterile, it's not sterile. This can stay just like that if I wanted to. Nothing wrong with that. So now, we're not going to use this in a lipo case to suture that. We're going to use these to cover things up, and or for spare drapes. This is a Mayo stand cover.
Yeah.
It would cover a Mayo stand, but we're going to use it essentially as a draw sheet. So you just pull it out and lay it across. If we were doing arms, it would go across the arms, but we're not doing arms today. This is the way this stuff comes. This is a half sheet, this is a 3/4 sheet. 3/4 is more than a half. The half sheet comes like this, you unfold it, and now it's divided in half just by the nature of the way they folded it. So you put your fingers under these edges and you lift and separate, and I've just folded the half sheet in half. So now this is a half sheet folded in half, and this is our drape for here. It goes down, you push it down, which is good. So now we can put everything on here. Gloves go here because you dry, you put on your thing, then you put on your gloves. All of this little stuff goes here. We'll deal with it in a minute. Get this off. The less the surgeon has to do, the happier the surgeon will be. When I'm wearing the surgeon hat, I don't want to be doing stuff that the person setting up should have done. This stays here. I'm going to throw this away because I don't want the surgeon to have to do it. We'll put these down for covering. Open our lipo kit. Make sure things don't fall. Toss that back there. Here's our infiltration tubing. Here's our paintbrush. I do that because it's sort of stiff. There's no need to put more than one indicator pad. This one has 5. No need. It's a waste of 4. No need. It's litter. 1. This is going to be for the painter. Now, as I said, you do everything for the surgeon so he feels like a surgeon and not like a medical assistant when he comes in the room. So you'll load this up. About 2/3 of the way back. That's ready to sew. It can stay just like that, and then you lay the needle down so it doesn't prick through the drape or anything. Okay? And it angled a little bit. I want the surgeon to be really happy. I'll do that. Blade. Let's load the blade up. It's on this side. This matches that, so you know that wouldn't work. And you just very gently slide it in here. It's all controlled. And that's it. It's in. This we're going to load up, and someone's going to hand me in a minute when we're ready the local. We have our 3/4 sheet. We have our lipo tubing. We put the lipo tubing under this because I'm going to use this first. Right? Because I'm thinking of what the surgeon's going to do. Now I'm going to cut this in half, and these are basically a blanket and a spare blanket. This will not go on the patient until the doctor puts it on the patient. I can load this up, the infiltrator on this, so again, save the surgeon a little step. Okay, and now we can leave these here. We'll take this like that and cover it. Now after the patient, as soon as the patient goes on the table, the lights get turned on. If it's not a lipo case, the ground pad gets put on. The SCD boots get put on. Now the patient is standing here getting painted. When they're done being painted, they lie down. We take this out so they can step. We remember there's a hole here so they don't get on it. And then we lay the patient down. We take this and we go like that. And we cover the patient's breasts and genitalia so they feel covered. Now they're not able to see what's in the tray. And we're done. Well, actually, hand me the cannulas now, and let's do that. The fluid. You don't have any open red, right?
No.
All right, so let's have this.
So when we cover, is there a man, do you stick it to that area, or do you do the unsticking?
You can't. You're not. It would be better for me if you know you're sterile and you want to do that. You can, but
Okay.
you have to make sure that you've been sterile.
Okay,
And
so-
then you do it in a sterile manner.
Right.
If you can do that, that's great.
Okay, so we'll work on that.
You know, basically, so now you have to open the inner one because now it touched. You see? So nothing. The case isn't. The stuff isn't. Do it so you don't rip it. So finish peeling it. You don't want it to stick and rip because then you'll have to re-sterilize that or get another one. There you go. There you go. That's enough. You don't want to tempt fate and get it to rip. And what's that, a long 3?
Yeah.
Okay, let's have it. Now, the next thing you're going to do, since this room is nice and cold, is turn off the air conditioning so the room will warm up a little bit before the patient gets here. And let's have the local. Then I have to find, I don't know what I did with the, there it is, 30 gauge. Let's go. And I'll only need about 2 cc's. And now the surgeon is ready to do most things. All right, done.
Thank
So
you.
just clean that up, put a paper down. You're welcome. Okay. What's his first name?
George McCarthy.